This is Jonathan Sobelman, and you are tuned into Treatment Savvy, where we provide curated content for consumers of mental health services. One of the questions that I get asked often is, Jonathan, what should I be looking for when selecting a residential mental health treatment facility? So I'm going to answer that question today. First thing you should be looking for is that the facility is Joint Commission accredited. What is Joint Commission accreditation? Well, the Joint Commission is a national accrediting agency that actually goes directly to the facility, meets with the staff, meets with the clients, reviews policies and procedures, surveys the property, and they only accredited facilities who have meet the highest standards of quality and safety in the industry. So you want to look for that Joint Commission seal on whatever website you are researching if you're interested in that particular program. The next thing you want to be able to look for is you want to see who the medical director of the facility is. You want to make sure that the specialty of the medical director is psychiatry and that they are board certified. As with any illness that we suffer from, when we need help, we go to a specialist. The specialist for any type of mental health issue is a psychiatrist. So keep an eye on the website, do your research, look under the staff page and see that a board certified psychiatrist is the medical director and sees those clients directly. The next thing you want is personalized care. You want the staff to know you by first name. It's hard to imagine that if you're at a facility with 50 to 100 other clients. Could you imagine suffering from some severe symptoms at one time or another while you're in treatment and no staff member is there to really be able to help you because you're lost in a sea of people? Well, you want to choose a treatment facility that has a small population. And this way, if something's going on, it's apparent to the staff that they need to reach out and get you the help that you need at that time. Another thing you want to look for, and speaking of personalized care, is that the therapist has a manageable caseload. I can't tell you how many times I've heard it, but clients tell me they're at facilities and their therapist that they see individually has 10 to 15 other clients. It's hard to imagine with deadlines and being able to see people consistently that therapist can give you the time and the attention you need in order to give you the best support possible. So ask the facility whether or not they have, small caseloads. How many clients does a therapist see at once? The last thing I encourage you to be looking for is if the facility advertises itself for being a dual diagnosis facility. Because most of the time, the feedback that I get from clients who go to a dual diagnosis facility is that their mental health issues are not addressed. They spend primarily all of the groups in discussing substance abuse issues. In the evenings, they're going to 12-step programs, and they're spending time in treatment and not getting the help that they came for. So those are the things you want to be looking for when selecting a residential treatment program. Now, if you enjoyed this video, please like it. Please like our page, Treatment Savvy, and spread it around. And stay tuned for more helpful information designed to help guide you through your mental health journey. Thank you so much.